Welcome to the #1 show and the source of truth for all things medtech. Here, we reveal the secrets and stories behind the investments, science, and commercialization of the medtech industry. Every week, we'll take you on a wild ride with the biggest names in the game, from entrepreneurs and investors who are shaking up the market to healthcare providers who are revolutionizing the way we think and practice medicine. So hold on tight and get ready for a journey like no other. This is the State of MedTech. Hey everybody, welcome back to the show. And if you're a clinician, just as a reminder, this episode you can actually unlock a CME credit thanks to our partners over at CMFI. So when you listen to this episode, click the link below and reflect on what did you learn and what will you do, and you'll get your full AMA PRA Category 1 CME credit. Now, women's health is an interesting topic because it's one area that has been generally or historically underfunded. We're starting to see more investments in the area, but I would say even a subcategory of that is prenatal care. Now, for me as a new father, I kind of went through this whole process where essentially I learned a lot about prenatal care and, more importantly, the associated risks and diseases. Fortunately, my son was born with no issues. I'm very grateful for that. One of the things that always shocked me was that something like 70% of newborns with congenital heart defects are pretty much left undetected during the prenatal period. And this really caught my attention because I have a history of heart disease in my family. And when it comes to congenital heart diseases, the key is actually capturing it early so you can do something about it. And an even more shocking statistic is that it's almost, I think, half of deaths in newborns with birth defects actually it comes from congenital heart defects. And so that's where Brightheart and my guest, Cécile Dupont, who's the CEO, come into play. I met Cécile a while back and learned about their company. And essentially what they're doing and their mission is centered around one thesis, which is if you're able to catch congenital heart diseases during the prenatal period, that's going to be the key to actually reducing newborn deaths. And the way they do that is using AI-powered ultrasound. You see, during the prenatal period when, pregnant women are checked, usually, it's done by ultrasound, but if you have any experience with ultrasound or seen it, it's more art than science. And so there's so many things that a human eye can miss, right? Because not everybody is trained to be a pro when it comes to using ultrasound imaging, including the clinicians themselves, because again, you have to be trained on this. And even with a lot of training, there's a lot of human error involved. And so that's what they're doing. And so this episode's going to be covering their company, which is Brightheart, and their product, which is essentially an AI-powered ultrasound. And so in this, we'll talk with Cécile to learn about the market, the company, and of course, where they are in their fundraising. So if you're an investor and you're interested to learn more about Brightheart, be sure to check out their website, which is brightheart.fr. Or if it's easier for you, feel free to reach out to me directly and I'll be happy to put you in touch with Cécile. So here's our episode with Cécile Dupont, CEO of Brightheart. Enjoy. Hey everybody, welcome back to the show. And if you're a clinician, don't forget you get an AMA PRA Category 1 CME credit from this episode. Just be sure to check the show notes below, click the link, and reflect on what did you learn and how will you apply the knowledge. So today I'm joined by a very interesting CEO from an interesting company, and I say that because, in the world of medtech, there's a lot of different areas that are getting a lot of funding. One area that hasn't gotten as much funding until recently is the area when it comes to newborns or pediatrics. Cécile Dupont is the CEO of Brightheart, which is a French-based company. I found out about it through one of the top venture capital firms in Europe, which is Sophie Nova. So Cécile, thank you so much for joining us. How are you doing today?
I'm good. Thanks for having me.
Absolutely. So maybe a really good question to start is what is Brightheart and what's the problem that Brightheart solves?
Yeah, for sure. So Brightheart is an AI company developing a unique solution to help and to support clinicians, and in particular OBGYNs who are in charge of detecting congenital heart defects during the pregnancy. So to support them with, by catching red flags during ultrasound exams and making sure that whenever something suspicious is found, the parents, in particular the mother, is referred to a pediatric cardiologist in a timely manner to confirm the diagnosis and to make sure that she can deliver at a specific hospital, so typically a maternity of level 3, and making sure that the therapeutic management for the baby can be implemented from the very first minute of life, after delivery. So very unique approach that we are developing at Brightheart, and very happy to tell you more about what we do.
Yeah, absolutely. And, just out of curiosity, maybe you can share a little bit about your background. What were you doing before joining Brightheart? I know you've been in medtech for some time, but maybe give the audience a little bit of background on yourself.
Yeah, for sure. So, I'm both the CEO of Brightheart, and I'm also a partner at Sofinova Partner that you mentioned just before. I've trained as a biomedical engineer, both here in Europe and in South America, and I've spent about 10 past years in the medtech space, and joined MD Starts, which is one of the strategy of Sofinova about 6 years ago. It's a structure which is both a medtech seed fund and an accelerator of medtech companies. And so I've been supporting a number of our companies in the past years. And so as part of the companies that have been created by MD Start, Brightheart is one of them, part of MD Start 3. It was created about a year ago and co-founded with 2 pediatric cardiologists who are based here in Paris. And, they wanted to develop something to support clinicians who are in charge of detecting these congenital heart defects that we call CHDs, and we're looking for the right structure to help them with that. So since October last year, we've been actively working on developing the solution that I mentioned before, and we've made really great progress in less than 12 months, and we are now at a stage where we started from a very blank page and now have a first version of a software that works. So really happy with the great progress that we made.
Fantastic. Yeah. And that was something that I did notice, is that you guys seem to have moved quite fast. So, what have you all accomplished just like within a year? Because the company is fairly young, but at least from your clinical milestones, you guys moved quite fast. What have you guys accomplished just in the past year?
Yeah, so as I mentioned, we started really based on an idea, but nothing more. Last year in October, we had the chance to start with these 2 clinicians whom I mentioned, and who have a private practice here in Paris, where they do a lot of fetal echocardiography. So over the 10 past years, they've consolidated a huge database of fetal ultrasounds, about 30,000 exams. Really enriched in congenital heart defect. And so with that, we were able to, start with I would say, a strong head start. But that was all we had when we started. And so, in a year, we've consolidated a team of AI and machine learning experts, so engineers who've been involved in the success of a number of AI companies. So some of them are coming from cardiologs in particular, at this company that was acquired by Philips a few months ago. And so with their support, we've been able to develop this first version of an AI software, which is able to detect morphological defects, which are suggestive of congenital heart defect, and severe ones, so the ones that really need to be detected during the prenatal period. We've also actively worked on the IP. So we have now 3 patents that have been allowed in the US as track 1, and so which cover both the platform, but also the algorithms that we developed, and the way we kind of treat the ultrasound videos. We've also worked actively with, regulatory authorities, and in particular the FDA, to make sure that we have a great and a good understanding of what the regulatory pathway is for that technology. So typically in our case, it's a 510K. We also wanted to secure and make sure we had a good understanding of what predicates we would use for that technology. So we actually had already 3 Q-Sub meetings with the FDA, and really started from the get-go. And it also enabled us to get a very comprehensive understanding of what it takes to validate clinically that technology, and what the FDA want to see in terms of clinical validation. So, we went back and forth with them to make sure that we had all the clinical protocols validated in the very detailed aspects of it. So we are now at this stage where we need to run this clinical validation, but we feel that it's pretty much de-risk from that standpoint. We've also worked very actively on the financing aspects of things. So we've been able to secure non-dilutive funding. So initially the project has been funded by Sofinnova MD Start through a seed round, but on top of that, we've been able to secure additional non-dilutive funding. And to finish with, in terms of governance, we're in the process of attracting an independent board member to provide expertise for the next steps of the project, and provide also some perspective on the US market and how to address this market in particular. So this is where we are today. So the next steps are really to validate clinically the technology for this pre-commercial version that I mentioned, and submit our 510K during the first half of next year. So with that, we'll be ready to start developing the V2, which is going to be our commercial version.
Fantastic. So I kind of want to go back to the problem. So you mentioned about essentially enhancing detection of congenital heart disease during like the fetal ultrasound period, which of course I would imagine is very difficult, just because ultrasound is already a very tricky thing. Trying to do it with like a fetal heart is probably extremely difficult. Today, like normally, how is there a statistic or anything on how often some congenital heart diseases are missed? What does that look like? Because I think we've all, especially for those of us who have children, like we've gone through that period of like going through the ultrasound, but usually it's most of the time not a physician who's doing it. Sometimes it's a technician and everything, but for the most part, you don't deal with a specialist unless there's something serious. Well, what does that look like?
Yeah, so typically, ultrasound exam, ultrasound screening is recommended for any pregnancy, whether it's in the US or in Europe. It's actually recommended worldwide, and in particular during the second trimester of the pregnancy. You have to remember that at this stage of the pregnancy, the fetal heart measures about 1 centimeter, so it's really tiny, and of course the baby keeps moving, so it's a very difficult exam, and that translates into 7 out of 10 congenital heart defects not being detected during the prenatal period, and that's really critical. It has a huge impact in terms of babies' mortality and morbidity. And one of the key numbers to remember is that 40% of newborn deaths happens in babies with congenital heart defects, and in particular in babies with congenital defects. So it's really a major problem, and that can happen to anyone. I mean, there is no good predictive factor when it comes to CHD. CHD can happen in any pregnancy. It's not because you have a low-risk pregnancy that it cannot happen. And actually 80% of CHD happen in low-risk pregnancies. So I think something really important is that ultrasound exam is very difficult. from a technical standpoint, but it's also very difficult to interpret. And the exam can be performed by a number of clinicians. It can be done by an OBGYN, it can be done by an MFM. In many geographies, it's done by a radiologist or by a GP. And for example, in Europe, it can even be done by a midwife. So that induces a lot of variability when it comes to interpreting, when it comes to training as well. And all those clinicians are non-cardiology experts. So which means that, the expertise that's required to interpret the fetal heart is actually not necessarily well conveyed to those clinicians, which translates in this huge rate of CHD being missed during the pregnancy.
Got it. Yeah, and you mentioned earlier, so 7 out of 10. So essentially 70% of these are missed. So when they are missed and they end up, what's the benefit? If the goal is for Brightheart to help clinicians catch these congenital diseases a lot earlier, are there therapies? I mean, what if you're able to catch, if you move that 70%, let's say down to 10% or less, so that way, all these congenital heart diseases are caught earlier on. What usually happens if a clinician catches it early? What do they end up doing?
Yeah, so it's a really good question, actually. So the standard pathway or the standard workflow for CHD detection is first you get screened by an OBGYN or, a clinician who is not a cardiology expert during the screening exam. So that's widely recommended everywhere. And so if there is something that's, seems abnormal during that exam, so not the clinician might not know exactly what type of CHD it is, but there is a red flag, then the patient is referred to a pediatric cardiologist. And then at this stage, the pediatric cardiologist, who is an expert, would, perform another exam, which is called an echocardiography. So really a specific ultrasound that's focused on the heart specifically. And he or she would be able to confirm that there is a CHD first, and then to refine the type of CHDs. And for most CHDs, it's really important that the defect is identified during the prenatal period, because as I mentioned earlier, the mother needs to deliver at a specific hospital, and in particular at a maternity of level 3, where they can implement a team of experts to take care of the baby during the first minute of life. The risk of hypoxia, for example, is really high during the very first minutes of life. And, if the baby is left undetected with the CHD during the prenatal period, then there is no appropriate management in place, and the impact on the mortality, but also on the morbidity, is really huge for those patients. And really, today, the bottleneck is this screening step. Once, the referral is appropriately done, everything is well managed. But the screening step today is really the critical step in that workflow.
Got it. So just to kind of repeat back, it sounds like the thing that's most important is that when you catch these CHDs during the prenatal period, that's really the most important part in terms of reducing newborn deaths. So if you're able to do that earlier on, you're able to reduce those newborn deaths. And
Absolutely.
Got it. And then obviously, because of, even if you're able to have highly specialized clinicians to do this, let's say a pediatric cardiologist or someone who's focused on infant cardiology, there's still a lot that can be missed. And this is where Brightheart's AI platform is essentially applied early on. So that way you're using AI to help standardize this screening test.
Yeah, absolutely. So the device or the technology that we're developing is really meant to support the first line screeners with the identification of potential heart defects or morphological abnormalities that should trigger a referral to a pediatric cardiologist. It's really meant to be what I call a second pair of eyes for the clinician, making sure that nothing important has been missed, and making sure that the referral pathway can be appropriately managed and done. So it's really making those non-cardiology experts become cardiology experts with the support of our AI software.
Got it. Yeah, and I really like that a lot, just because I think that one of the more exciting opportunities in medtech, specifically for venture capital and investing, is this kind of wave of, to have like truly standardized healthcare, you have to kind of take the expertise of a specialist and put it across generalists, which is all primary care. And the only way you can do that is through software. It's essentially your AI software is making every clinician, whether it's a OBGYN, a nurse practitioner, et cetera, an expert in fetal cardiology, correct?
Yeah, absolutely. It's exactly what we do. We make sure that they can all have this expertise of almost a fetal cardiologist, and making sure that they're able to identify those tiny morphological abnormalities that really needs to be taken care of.
Got it. And so then, just, I know you kind of touched on this earlier, but just to kind of dive deeper into workflow. So, somebody comes in during first trimester to their doctor, they get an ultrasound. How does this all work? Is Brightheart essentially installed into all fetal heart on all ultrasound machines? What does that look like? And then what's the actual specific workflow? Is it as simple as they do the ultrasound, Brightheart's AI analyzes and then like flags things?
Yeah, so actually, just to make sure we everybody has a good understanding. So this is an exam that's done during the second trimester. During the first trimester, the heart is really too small. Like we might end up doing that in a few years from now. But today, the recommendation is really during the second trimester. And so the standard workflow. So without our software, the standard workflow is that you have a sonographer performing the exam. So based on using a standard ultrasound machine. And then most of the time, the clinician would review the exam offline, based on his standard EHR, and would just sign the report. And if everything looks normal, then the patient goes home. If the sonographer catches something abnormal, then this person would kind of inform the clinician, and he would pay specific attention to that case. The way Brightheart works today, so it's a SaaS solution that we're developing, and which is compatible with any kind of ultrasound, and that's really meant to be embedded into the standard workflow. So we don't want to interrupt or impact the standard workflow. We want it to be really seamless. And so the sonographer would perform the exam as per standard of care. And so once the videos, the ultrasound videos are while they're transferred to the interpreting clinicians through the PACS, our software connects directly to the PACS, and these videos are sent to the cloud, where they're analyzed by our Brightheart software, and the annotated videos are sent back to the PACS and then sent to the clinician for interpretation, so that he can quickly identify the cases which require specific attention, and all that is done while the patient is still on site, in case the physician might want to redo partially the exam, making sure that all the views have been correctly identified, and also inform obviously the patient of the next steps if she needs a referral to pediatric cardiology. So it's really meant to be fully seamless and fully integrated into the standard workflow. But as I was mentioning before, we've decided to go through a two-step development process, I would say. So the version, the V1 of the software that we're developing today is really our pre-commercial version. The objective is to be able to deploy this version in a number of clinical sites, and making sure that we can collect as much clinical feedback as possible, making sure that we can also capture and understand the different settings that might be that you might have in the US, and making sure that the V2, the commercial version that we develop, takes into account these these differences that we can have in the US market, and making sure that we develop features that correspond to clinician needs as well.
Fantastic. Now that we have a good understanding of the technology, I do want to talk about the market. So what does the growth rate of the market look like? How big is the market? I think like the US one is probably the most important, just because like for a lot of medtech companies, making the US is important. But I kind of, if you have the numbers, I'd like to know like both US and global markets.
Yeah, so it's actually a huge market. Screening exams are recommended for any pregnancy in the world. It's the case in the US, it's the case in Europe, and it's the case in Asia as well, for example. So, for example, in the US, it represents about 4 million exams per year. Same in the US, and if you take China, it's about 9 million per year. So it's really a huge market, and you have to remember that, again, there is no good predictor when it comes to CHD. So any pregnancy is actually concerned by this issue. And so that's a technology that applies to any pregnancy in the world. So that represents a huge opportunity. And that's happening actually in an AI ultrasound market that's just booming as we speak. So, in terms of opportunity, it's actually really large. And it can it's applicable to any geography.
Fantastic. So, and I like companies that are going after things that already are like have a standard of care, standard guidelines, and you're just kind of working yourself into that. So this is already, that's something that's standard and recommended for all pregnancies, and your thing is just to essentially improve the efficacy of it.
Yeah, absolutely. That's a good point. Guidelines have been in place for many years regarding screenings of CHD and screening of fetus in general, and that's here to stay. There is no reason why this would change. It's actually we see that the guidelines are becoming more and more stringent when it comes to detecting congenital defects, and so. It's a set market, and which is here to stay, and clinicians are also recognizing that ultrasound, and in particular the fetal heart evaluation, is one of the most difficult exam in their practice, and they are willing to do better, for their patients, willing to do better for them, and I think they're also really scared by the risk of getting sued. So that's they're really in favor of tools which are able to secure their exam and to support them in providing a better diagnosis for their patients.
Got it. Yeah, and it makes a lot of sense. Right now, how much are you guys currently raising? You're doing
So yeah, we're just starting raising our Series A, and we're raising between 8 to 9 million to get to the commercial version of our software.
Got it. And this is kind of a good question. Is like, so you guys aren't commercial at the moment. You guys are. When do you expect conservatively that you guys will be commercially available in the US?
So we plan on having an initial 510K by next year. That's going to be on our V1, so on our pre-commercial version. And then the V2, so our commercial version, would be 510K cleared by 2025. So we plan on being commercial by probably second half of 2025.
Second half of 2025. Okay, got it. And so a lot of the funding that you're doing, the raise now, is just going to help you accelerate through the regulatory pathway and then also prepare for that commercial launch.
Yeah, absolutely. So, we see this V1 as a way to not only access a number of clinical sites, getting insights on what should be embedded into our V2, but it's also a way for us to secure an initial 510K, which is going to represent a strong step for the rest of our regulatory pathway, in particular for the 510K of our V2. So we really view this, this initial development, first 12 months as a very strong de-risking process on all the fundamental aspects of the project and of the company. So the focus of the Series A is going to be to grow the team. Obviously, we're going to need more people to help us not only with the development of the technology, but also on the clinical and regulatory side, making sure we also have people on the product side to develop something that's relevant for clinicians. And we want to, get ready to for a pre-market release, I would say, in the US. So get a better understanding of the US markets. So with that, we want to make sure that the Series A is there to support the development of the V2 and its pre-commercial launch.
Got it. Fantastic. And, so you guys, it looks like you guys moved quite fast just in terms of what you were able to accomplish in a year. Can you tell me a little bit more about the team? Like, who's on it now? I know you guys are obviously expanding with the raise and everything, but who's on it now that's helped you guys achieve that level of success?
Yeah, so today the team is really supported by a team of AI and machine learning experts. So those are people, so AI engineers who've been, as I mentioned, involved in the success of a number of AI companies in the healthcare space. So that's, I would say, the core team today. We're a team of 5, so it's pretty small. But we, the two cardiologists who were co-founders of the project have been also very much involved in the early days and are still very much involved in the project. So making sure that the structure we've been thinking about for the V1 actually makes sense from a clinical standpoint. So, I mean, CHD is a very complex condition, so having clinicians working with us on a daily basis has been very helpful and is still very helpful. They've been also involved in annotating a lot of ultrasound videos. That's the heart of AI companies. So they have been very, very helpful with that. And we also have the support of US clinicians. So in particular, Dr. Aruna Mehta, she's a pediatric cardiologist at Stanford. We're also working with people at NYU Langone. So, we have internally a small team, but we are working with a lot of people outside of the company. Same on the regulatory aspects of things. We work with consultants who have a strong knowledge in the space, who've been working for the FDA in a number of years. Same on the IP side. We have a strong IP team behind us. So, I would say the core internal team is still limited, but we've surrounded ourselves with people who are experts in the space.
Fantastic. And what about in terms of the hospitals you're targeting? Well, if you can talk first, like a little bit about the revenue and business model, like how are you guys going to make money? But then also, like in your before you guys go commercial, who are you targeting right now in terms of hospitals? So if you can talk about the business model and the targets.
Yeah, so I think we can define or segment the US market in 3 different buckets. There is the children's or kids hospital who are taking care of these babies with CHDs. It's a limited number of hospitals, but they're very important to be convinced by our approach. They're actually the one who can spread the word and raise awareness in the community about the support that an AI tool can bring. Then there is a second segment, which is a segment of MFMs who are affiliated to those children hospitals. So those are clinicians who are usually in charge of high-risk pregnancies. So it's a pretty well-structured and well-defined network of clinicians. Probably easier to target. And then there is a third segment, which consists of private practices of OBGYNs. It's much more spread out all over the country, but it represents a massive number of clinicians. So we want to have this, step-by-step approach and having this awareness efforts that is going to be really key in making sure that the adoption is successful. In terms of business model, we are considering an annual or monthly license for our software. As I mentioned, it's a screening device, and we want it to be used as much as possible. If we want to, have a strong impact on those babies' mortality, it's really key that it can be applied to any screening exam, and we don't want to, prevent the physicians or the clinicians from using our device just because of a price constraint. So that's something we're embedding into our business model and pricing approach to make sure that every patient can benefit from that technology, and there is no longer a CHD that's missed during the pregnancy.
Got it. And then today, like, again, I know you guys aren't commercial, but are you able to mention any of the hospitals that you're currently working with? Any noteworthy hospitals at all?
Yeah, so we've been, of course, actively discussing with hospitals, clinicians, payers in the U.S., and we've received a very favorable feedback from them. But as I mentioned, we are working with physicians from Stanford already, who are actively supporting us, in particular with the development of the approach, making sure that what we're developing makes sense. We are also working with a number of hospitals on the East Coast, and in particular with Valley Health, with NYU Langone, and we have much more individual clinicians working more in private practice settings who are willing to participate to the project, either from a data sharing standpoint, but also clinical validation. So we feel that there is a strong traction for this approach, and actually same in Europe. Because we benefit from the network of our two co-founders. We also have a strong support from physicians in Europe, and we're willing to make things happen and see their practice change quickly, and have their patient benefit from what we're doing.
Fantastic. And, in terms of heading into like 2024, assuming you guys are able to raise successfully and everything, what are some of the big obstacles that you guys, are looking to get over? Like, first of all, like, are there any, competitive products in the market? Because you mentioned you're doing a 510K. So what does the competitive landscape look like?
Yeah, so I think the good thing is that there is now a number of companies in the space which are, trying to improve the clinical practice, in particular with, the prenatal ultrasound exams. We are actually the only one developing such an approach of, catching CHDs based on video ultrasounds. But there is a number of companies in the space who are trying to standardize the ultrasound exam in general, not only focused on the heart, but making sure that, we come up with something more standardized when it comes to, catching the appropriate views for each organ, making sure that the report can be streamlined as well. Today, it's a pretty complex and long exam, and which is done, in very different ways, depending on the clinics or depending on the settings. So I would say that our competitors in the same space are more on the quality sides of things, making sure that, things are standardized and all the views that are recommended by guidelines are actually appropriately documented. But today we are actually the only one targeting the heart in particular, and making sure that heart defects are appropriately detected during the pregnancy.
Got it. That's fantastic. And just to kind of wrap up again, thanks for coming on the show. For those who are interested to learn more, I know that you're very, become more active on LinkedIn, but what's Brightheart's website?
So we have a website. It's called brightheart.fr. And so you can find information on there and learn more on our co-founders as well. And of course, you can also reach out to me. I would be very happy to tell you more about what we do.
Perfect. Fantastic. Cécile, thank you so much for coming on the show. I want to remind the audience, for those of you who are clinicians who are listening, to make sure to unlock your CME credit. Just click the show notes below and go ahead and submit. What did you learn and what will you do? I'm your host, Omar Khateeb, and this has been another episode of the State of MedTech, and we'll see you all next time. Bye for now. Thank you for enjoying another epic episode of the State of MedTech. If you're feeling inspired and love this episode, do us a favor, hit that subscribe button and turn notifications on so you never miss an episode. And be sure to give us 5 stars and write a short review, because that helps more people discover this amazing community of ours. If you're a company who has an executive that you'd like to be on the show, or perhaps you want to sponsor one of the episodes, shoot us an email at hello@khateebandco.com. Take care, and we'll see you next time.